This is LiveWell Talk on Parents Back to School Checklist. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's Hospital. With the school year starting, it's important for parents to make sure their kids are healthy and ready to learn. Joining me today to discuss what parents should keep in mind as their children head back to school is Dr. Dinah Conti, pediatrician with UnityPoint Clinic Pediatrics, Tower Terrace, and Lindsey Fiechtner, physician assistant with UnityPoint Clinic Child and Adolescent Psychiatry. Welcome both.
Thank you.
Thanks.
This is Dr. Conti. This is your fourth podcast.
I believe so.
And Lindsey, this is your first,
Yeah.
but so the standard's set pretty high. School, and Dr. Conti, I talked about this before on and off podcast. The pandemic, the hiatus of learning. There's a lot of anxiety going back to school. I think, some children haven't recovered, quite honestly.
Agreed.
So what do you recommend parents have on their back to school list? Beyond pencils and paper, et cetera.
Sure. An emergency call list. I think a kid who is particularly anxious about school should have an idea of who they'll call if they are having trouble emotionally or physically. Also making sure that they have made contact, the parent and the kid have made contact with a school counselor or with the homeroom teacher or someone during the school day that the kid can go and see if they're struggling. I think that's a really good way to just start any school year, but especially post-pandemic. It's pretty difficult for a lot of these kids.
Yeah. I worry about them. From a healthcare perspective, what do you recommend? Just physical things, clothing, etc. What do you sit down and discuss with them when you see them?
Yeah, well, I discuss with them the water. Oh my goodness, these kids don't drink enough water. So a water bottle is a great plan. All the schools have a way to refill that. In fact, I like for families to give their kid an older elementary kid or middle school or high school a 1 liter water bottle. And I challenge the kids to drink the whole thing by lunchtime and to refill it and drink another one by supper time. So they're getting a minimum of 2 liters a day, which is awesome. And if they're playing any kind of sports or activities, especially outdoors right now, they need more. They need more fluid. For the younger kids, a 1/2 liter water bottle, and to try to drink it by lunch and then another one by supper time. For the older kids, they say, I'll just drink all of it after school, and they're going to be up all night peeing, and that's not good for anybody. So, but that's a good start.
But then how do they use the excuse to go get a drink to get out of class and walk around and look through windows at their friends?
Sure,
right. You might be taking that away.
Then the excuse is I need to use the restroom.
Yeah, and then you have to use it. Yes, exactly.
Oh, darn.
I tease my daughters all the time, and my wife too, to a certain degree. I drank out of the drinking fountain, and I did fine. But that is very common for youth to have a water bottle, which was different from when I went to school, of course. Well, you see these individuals for their sports physicals. You always had your physical. What's elements of the sports physical that you look for? What is something that you really strive to achieve in those meetings with the patient and the parents?
Absolutely. So in the sports physical in particular, we're looking for sports readiness. I need a kid to be knowledgeable about what their schedules are going to be like, or how much of an impact this is going to make on their day or their week. To just plan that they still need to be studying or reading at night, but also making time for their sport and still making time for family and to connect with their family. For the sports physical, we also check muscles and joints. We check a neurological exam, which is, the brain and the nervous system and how those connect. And we talk a little bit about concussions or what a sports injury might feel like and what they should do next. A lot of the schools have trainers who are excellent and can really be helpful. For some of the kids, though, they're still taught the no pain, no gain.
Yeah.
And I let them know that pain and soreness are 2 different things. Tired and sore, those are okay. True pain, you need to stop. and get some help. So sometimes it takes saying that to the family too, not just to the kids, so that they're all on the same page.
I think it's state law that schools have to employ a trainer now.
That's great.
I think that I want to say that's either active or in the works.
Well, that's awesome. Because they do. They play such an important role. They're right there, and they do get to know the kids, and they know the team. So for some kids, they get injured on a particular team, and if it's the same team and multiple kids are getting injured, that trainer is the one that knows that.
And I can tell you from experience, I lecture at Co to their athletic training program when they had it. It's a master's degree now. And those guys are sharp.
Absolutely.
I was always impressed with their knowledge base and their skill set. I was just always impressed. But I should know this. Do children have annual exams as well?
They do.
And I guess that tees up my question. The annual exam is not the sports physical exam.
Actually, it's the other way around. The sports physical is not the annual exam, but the annual exam encompasses both. So an annual exam is not just sports readiness, but other health too. So social relationships, body image, sleep habits, eating habits, skin care. For a lot of these kids, they've got questions about their acne or body odor. For some kids, they reveal to us at their visits that they have headaches, or that they have this funny mole, or their back hurts often. And so those are things that we would identify at a well physical or a well visit that you may not pick up at a sports physical. Now, we do, as part of the well visit, the sports readiness. So if you get a well visit with your primary care pediatrician or family medicine PCP, then you're getting your sports physical too. Sometimes there are a few extra questions that we ask if we know that you're going to be doing sports, but the well visit is all encompassing. The sports physical is really targeted. So it's targeted to the sport you're going to play or to a few sports, but you really don't get into those other factors. Also at a well visit, we update vaccines, which it's so important to catch those kids when they're in the office to go, hey, you're due for this, or we need to protect you against this condition. And so the sports physical, there may not be time set aside to do that.
Got it. Yeah. What are the big required vaccines for public schools now?
Yeah, so there are 2 for middle school and high school, and those are the meningococcal vaccine or meningitis vaccine. And there's the tetanus or Tdap is also what it's called, but it has the tetanus vaccine, diphtheria, and pertussis or whooping cough all in one. So those 2 are required by schools. And those are required before you can enter 7th grade. And then there is a second dose of the meningococcal vaccine that's required in high school, so around 16 or 17. Additional to those, though, are some really important vaccines that are not required by schools. One of those is the HPV vaccine, which protects against HPV-related cancers. So cancer of the mouth, the throat, the penis, the anus, the vagina, and the cervix. So a cancer preventive vaccine is so important for everybody. And also there is a meningococcal vaccine that high schools don't require, but some colleges do, that's called MenB, and it protects against an additional strain of the meningococcal disease.
Yeah, it's very common. Yeah. Military barracks.
Exactly.
Dormitories.
Exactly. So I tell kids about that. If you're going into the military or you're going to college in any way, or in some jobs, you may be required to get this, and it's a good one. So get it, whether you're required or not, is definitely something to talk with your doc about. And then, of course, the flu vaccine, we recommend that every year. We're coming up on flu season. Yeah. So we're going to get kids and adults, hopefully all ages, 6 months and up, vaccinated against the flu starting in September. We try to get the majority of people vaccinated before November, because that's when we start to officially see our flu season in this area. So getting people up to date on that. And, of course, a COVID vaccine. So we're trying to get all that in.
I've always had the rule 2 weeks before Thanksgiving, because that's the first time that you're all going to be crammed in a room
Exactly.
Together.
You want to have your immunity at its peak.
That's always been my rule. we're going to have you back and talk about HPV, because the data on that vaccine and how it's preventative, it's impressive.
It is.
It really is impressive.
Agreed.
I was maybe a month ago, was reading the literature on that, and I was like, wow, this is really impressive. This is a no-brainer.
I agree.
Honestly. Yeah.
Absolutely. I've had mine. My kid has had hers.
Yeah.
Absolutely.
It was kind of controversial, wasn't it, when it first came out? And
it was.
It shouldn't be.
Right.
Because it
Agreed.
really is impressive data.
Agreed.
Well, Lindsey, we didn't forget about you.
That's all right.
I'm sure you have
enjoying the conversation.
Yes. So what's your checklist that you go through from a mental health perspective for children?
Sleep hygiene. We missed the boat a little bit, but right before school starts, typically 2 weeks leading up, I'm telling parents, like, there is a bedtime now. There is a wake up time. The wake up time is huge. Because if you allow your kid to sleep till noon, they're not going to be ready for bed at 8, 9, 10 o'clock at night. So really working on kind of stepwising the sleep back to a regular school schedule. Weekends are hard because we don't have school the next day. We want to stay up later. But I typically recommend, if you are someone that struggles with sleep, to not deviate from your schedule too much, because come Sunday evening, you're starting over.
Yeah.
So sleep's a really big one. And then just taking out some of the morning chaos. So anything you can do the night before to kind of prepare for the day ahead, setting clothes out, packing lunches, getting your backpack ready. All of those things that can be done ahead of time, I recommend doing.
That's good advice for anyone, quite honestly.
Truthfully, yes.
Yeah.
But typically your kiddos that, I see a lot of ADHD, anxiety, depression. Early morning functioning is very difficult. We've got the early morning jitters, or our ADHD medications haven't kicked in for the day, and it is just a more chaotic time of day. So anything you can do to set yourself up for success from the start is going to be helpful. Some of my kiddos have more of like behavioral issues, and there's more defiance. And that's a tricky time of day because a lot of demands are being placed. Like, you need to get your shoes on and your socks and your bag ready and your coat ready. And so when that's met with a lot of defiance and arguments, that can be difficult. So I'll sometimes recommend that parents do like charts, and you can have your child refer to the chart. So rather than the demand kind of being placed on them, they have a visual that they can follow. And that seems to work really well across the board. If it's an older kid, planners or checklists, things to kind of help them stay on task in the morning. That's going to help if you have ADHD, but also if you have anxiety, because if you have that visual, you're going to know that you've kind of checked everything off of the box that you need to in the morning. You're going to head out the door knowing that you're prepared for the day.
My kid's a lot like other kids where, she's a high schooler, but, I tell her you need to do these things, and it's, Mom, don't rush me. The checklist really works well for her because then, she looks at it. She's not having to hear me talking in the morning when she's trying to wake up. So it really does help.
Yeah. So that's a big one.
Well, if I'm a parent and my child is either on chronic medications, you mentioned the attention deficit medications, or insulin, if they're diabetic, a little bit older kids, or they have food allergies or medication allergies, but maybe food allergies. How do I notify the school? How does that happen?
I think that's typically part of the registration process at school. When you register your child for school, you're listing allergies that they have, medications that they take, conditions that they've been diagnosed with, so that the school's aware. Now, whether that gets to their classroom teacher or not, I'm not entirely sure. I know the school nurses typically will have access to those records, but it might be worthwhile during open house or even just ahead of school starting. Shoot your kid's teacher an email and let them know. Maybe just a little like about me profile, like, hey, here's a little bit about my child that might be helpful headed into the school year.
Because I think epilepsy, asthma, diabetes, those are medications that would interfere with the school day.
Absolutely.
Potentially. And so you'd want people around them to be knowledgeable about it, particularly if they had an epileptic, or what the rescue plan was,
Absolutely.
et cetera. Yeah, that's important.
I always recommend having those things that notice to the teachers in writing or to the school in writing so that they can review it later. at open house, I mean, we're all talking to the teacher all at the same time. So like you said, a little email or a paper that says this is what my kid has. These are the emergencies. For us at their well visit or in preparation for school, we have, school medication sheets or allergy action plan, asthma action plan, or the seizure action plan.
Yeah.
Those are important. And for a lot of those kids, they like the ones with diabetes, for instance, or seizures, they would qualify for an IEP or a 504, some sort of plan that the entire school officials and the teachers and the family are all aware of, that there's a specific protocol to follow if the kid has an emergency during the day. So, and again, that's written down. So I think any of that you can prepare and give at registration is so important.
Or even just having like a 504 plan or an IEP meeting. Sometimes you can get those scheduled prior to school starting, but the earlier in the year that you can get those established, the better, just so that parents know what's included in those, the teachers know what's included from an administrative level, everybody's on the same page. Because sometimes the plan needs to be shifted or changed depending on, I guess, more in my realm of things like anxiety, depression, behavioral problems. Kids can sometimes outgrow certain things, or they get on a medication regimen that's really solid for them. And maybe we're graduating from our IEP, or we're graduating from that 504 plan, or some of the like really strict measures on it can be kind of eased off of a bit. So really like meeting the kid where they're at and figuring out, well, what additional resources do we need this year, and having that earlier in the year is better.
Well, I don't know if you've seen the meme. I think that's what it's called. Dad attends parent-teacher conference to find out what grade his kids are in. Because I mean, that was our way. Tanya always handled all this, and I was kind of a spectator. But it's important to be involved.
Absolutely,
the kids that do well, the kids that are healthy and happy, have parents that are involved. So
absolutely. Well, my husband's a stay-at-home dad, so he's the one that knows all the things. And so he and my daughter tease me a good bit that do I know what time school starts? Maybe. Do I know what time school gets out? I'm not sure.
Yeah.
I make a whole lot of decisions and recommendations for people during the day that it really helps me so much that her father and I talk every day, that we, as a family we talk, and that he's got this. So I can be the one that goes, you guys take care of it.
Yeah.
You're awesome.
Yeah.
It's important to know what hat you wear at home, and that one's not yours.
It is.
Yeah.
So Justin, you and I wore the same hat.
Yeah. And then if you get home early for some reason, you're just in the way.
Exactly.
You're just disrupting their routine, and your best to stay out of the way. So now, this is more towards you, Lindsey, but I know Dr. Conti can answer this as well. Is what should I be watching as a parent to say, okay, Junior's having some troubles here at school? What, I can think back to the chronic stomach aches, kids would have, our daughters when they're little, oh, my tummy hurts, I can't go to school. Well, maybe there's something else going on. What should a parent watch for?
I would say looking for patterns in that. So if we're complaining of stomach aches Monday through Friday, but we're fine on the weekends, that could be a sign that maybe there's something happening at school, or, that's a more difficult time for them. Anytime there's a physical complaint, I do recommend checking with PCP first. I want to make sure that there isn't a medical condition that needs to be treated.
Yeah, you don't want to miss.
Exactly. Before we're calling it a psychiatric condition. So absolutely checking with PCP. By the time that they're sitting in front of me, it's very helpful to hear, we talked with Dr. Conti and she checked labs or, did a physical and she felt like everything was fine. So we're really thinking that it might be something else. So the stomach aches, the chest pains, the frequently calling from school in the middle of the day for headaches. Headaches is another big one with anxiety. If there's a certain time of day that you're consistently getting that phone call, what class is it? What subject is it? What teacher do they have? Checking with that teacher. Is there a bully in that class that the child's dealing with? Is there something outside of medications that could be addressed to help them have a more successful day at school? So that's kind of the warning signs there. And then typically we don't hear about these things until after fall parent-teacher conferences, but I get a lot of oh, they are not doing well. So if you know that your child has difficulties with learning or focus problems or things like that, checking in with the teacher, not kind of waiting until we're a quarter of the way through the year to find out, oh, maybe their ADHD isn't being well managed. Because now we've missed out on 25% of the year that maybe could have been more productive for that child. If a child hasn't been diagnosed with a psychiatric condition and there's kind of speculation of or concern for, follow up with PCP so we can get those referrals made.
Okay.
Our clinic only accepts referrals from UnityPoint clinics, and we can hardly keep up with that right now.
I know it's you're in demand.
So yes, it's me and then the nurse practitioner I work with, Brittany Benda, are the only two in our region. We see kids as far as Clinton and Mason City and south of Iowa City and Marengo and all the way out towards Des Moines that travel a long ways to see us. We are in the process of hiring a third provider, so that's exciting news for us. We have an interview today. So that's exciting news. But checking in with your PCP, getting those referrals made, and then kind of coming in to see us. Even if you're like, maybe I'm not excited about medications, it's not a bad idea to visit with us to see if that's something that would be recommended. So when I'm recommending medication management to kids is if socially we are being impacted, if our anxiety, depression, ADHD is interfering with our ability to make friends or to behave in a way that, is socially acceptable. So those would be reasons, one of the reasons. Academically, if your kiddo typically was somebody that was making great progress, trending where they should, following, the grade level that they're supposed to be in, and all of a sudden we're not making academic growth, or we're not completing our homework, and we were a kid that typically would. Any changes in that would be a reason to really look into, are our moods impacting our ability to perform, or can we really just not focus enough to get our work done? Those would be, so academically, socially.
It comes back to be involved, understand what they're doing, what they're... Let's talk about the ADHD medications.
Yeah.
Do they still take the break in the summer?
Some do,
some do
don't.
That? Okay.
I recommend it if kids can. I call them medication vacations. So even, holiday breaks, Christmas breaks, things like that. If they're able to go without medications, it's better in the long run. So stimulants specifically, non-stimulants, I wouldn't recommend those breaks. But with a stimulant medication, those are medications that they can get used to over time. Their bodies can develop a tolerance to them. So taking those breaks is great to prevent that or to push that tolerance down the road a little bit further. The other reason I recommend it is growth and development. These medications across the board really do impact kids' appetite. So, we watch growth and development pretty closely. I make sure that we're not straying too far from their curve. But if appetite is something that is decreased or that's something that they notice, then having those breaks is really great for them just to have those growth spurts over the summer to get those extra calories in the day for reasons like that.
Yeah, I coached Little League one time, Iowa Kids League, way back when, this in high school. And like during the school year, I had a couple kids who are just like sweet, and then all of a sudden after school gets out, they get off their, and they're like just having chimpanzees in the dugout, just climbing everywhere. I mean, so the parents are like, "Oh yeah, I forgot to tell you." And so that's why I asked that question, if they still do that.
Well, it's funny you say that because I know this is one of the things that you guys talk about with families too. As a primary care pediatrician, one of the things I talk about with parents is chronic disease, and ADHD is one of the chronic diseases.
Mm-hmm.
For a lot of people, they continue to have symptoms of their ADHD even into adulthood. So for those kids who really struggle with their symptoms, and for a good number of them, they're actually disabled by their condition, by their symptoms. They're going to put themselves in harm's way. They may run into the street, or they may run off and not really realize that they're putting themselves in danger. And so I remind parents that ADHD is a chronic disease. We don't stop taking our hypertension medicine because we're on vacation, or stop taking our insulin because we didn't eat much that day. And for some kids, they continue to take their ADHD medicine even through the summer or holidays.
Yes, there are
because,
kids who are
some
so
of them just
hyperactive
can't.
and so impulsive that they really are a risk to themselves or others.
Yeah.
And I think something that's not talked about often is how much mood can be impacted by ADHD.
Mm-hmm.
A lot of kiddos will have like a significant amount of irritability, anger, agitation, frustration. So the trade-off of being able to skip your medicine to be like angry all summer really isn't working.
Yeah.
So
No, that's
yes, if their moods are significantly impacted by ADHD, or if their behaviors are so extreme that they're going to be kicked out of daycares, or not be able to attend field trips, or really just their quality of life. If their quality of life is negatively impacted by not medicating, then we absolutely recommend continuing through summer and breaks and weekends.
Mm-hmm. Yeah. I think that's just an example of why we need the kids and the families to keep coming back, not to just assume that their follow-up in 3 months or 6 months is the only time they can come in. So
Yes. So I think another thing that's going to be important this year, especially to communicate to teachers, is there is a nationwide shortage of several ADHD medications. Yes. So a kiddo that typically would be medicated may have days this year where they're going to school without medication, and it's just because parents can't find it.
Wow.
So 4 of the most common medications we use, Concerta, Adderall, Vyvanse, Focalin, those are all in shortage right now. So kind of communicating that with the teachers and with the school districts, because there's a lot of schools will call if kids are having a difficult time. Right. So if you can communicate that ahead of time, hey, my child, I wasn't able to get them their medication this morning. They may have an off day today. Then the teacher's going to know what to anticipate. They may extend that child a little bit more grace, knowing that they're having a more difficult time that day. That's new this year. I'm hoping that it gets better. Unfortunately, it does seem to be getting worse, not better.
Agreed.
So hopefully the end is in sight with that. And then communicating with your mental health providers, or if your PCP does manage your ADHD, communicating with them if you're unable to get your script. We can always send them to other pharmacies if another pharmacy has it available. We've been doing that a lot this summer.
We have to.
Mm-hmm. Yes, parents will call around and, this Walgreens that I typically use doesn't have it, but the Walgreens on the other side of town does. Great. I am more than happy to cancel out that prescription and send it to another one so that your child has their medications.
That's good intel.
Yes.
I did not know that. I mean, I'm pretty familiar with the shortages in the hospital.
Yes.
Just where my role is. But I had not heard that. So that's good intel.
Yeah. So that's another important communication piece to keep the school and teachers involved in that, just so that your kiddo's being cared for in the best of their abilities too.
I probably should do a podcast on someday about the supply chain.
Oh, yes.
And how we deal with that every day. I mean, it used to be like you never dealt with it. Didn't even think about it.
Right. I didn't think about running out of gloves or
right. Yeah.
or paper towels.
It's a new skill set you have to have to
and now
troubleshoot
medications.
this.
Absolutely.
Yes, absolutely.
Great intel. Thank you for sharing.
Yeah.
What about staying on kind of this line of being involved in monitoring them? What's a sign of a learning disability? I mean, the teachers are probably pretty good about saying, okay, this so-and-so is having a problem here, but what's something that parents should look for?
That one's a lot tougher to recognize because is it a learning disability, or are they dyslexic, or are they, inattentive? Is it just ADHD? And if we can get them focusing well, then academically they could soar. So the learning disorders is a lot harder to catch. And you may be more aware of this as well. AEA used to be very involved in that. Are they still? Is that what you would
They are. If you want an evaluation through the school system, Grantwood AEA is the way to go. For a lot of our school systems, though, just like everywhere else in the community, sometimes funding is an issue. And so they may not be as quick to do the evaluation for your kid. So there are some private agencies in the area, including St. Luke's Counseling, that will do some evaluations for learning disabilities and ADHD, especially for those that haven't even considered medications as an option, that they may want to take that route. But learning disabilities, there is a specific type of testing for that For some kids, they do have inattention to the point that they cannot participate in that type of testing.
Yeah.
So sometimes targeting their ADHD first and then doing the testing is important. But it just, again, it's about communicating what your child's struggles are and what your needs are, and then just keeping building your group, your support group of medical professionals.
A lot of those private practices that do the testing with private insurance, it is not well covered, and it is very expensive. So I think the best route or the most accessible route is working closely with the school. And if your child is not meeting those benchmarks or progressing academically the way that you would anticipate, looking into an IEP. So those individualized education plans where they can pull them out for more like one-on-one reading support or math support, or just getting, smaller groups where they can have more attention spent and spend more time in those areas that they are struggling, to try and either get them caught up or prevent them from falling further behind at least.
Right.
Agreed.
Because you always have the kid that is the class clown, but it's because they're trying to hide the fact they're not
sometimes
learning as well. Or
because school's hard. It's easier for me to be silly.
Yeah.
And again, with asking for the school to do an evaluation or to intervene, ask in writing. It's so important because everybody forgets the conversation that they had.
Oh, gosh. Yeah.
Us included.
Yes.
Well, kind of wrapping up here, what is one memory from the start of school each year that you remember that from your childhood? We'll start with you, Lindsey.
School supply shopping. I loved shopping for school supplies. I loved those back to school nights and unpacking everything in my desk and having it just the way I wanted, figuring out where I was going to sit. And teachers are amazing. Like I could not do their job. They are fabulous, fabulous people. They make their classrooms so homey and special and memorable, and they really go above and beyond for kids to make that transition back to school as seamless as possible and as anxiety free as possible. And I think that I remember feeling that every year when I went back to school. It was an exciting time. And I always felt very well cared for at school.
Yep. Mine, definitely the school supplies, especially pencils. Like you'd get these cool pencils or the cap erasers.
Oh, yeah.
Or they smelled, we had some smelly erasers that smelled like strawberries.
For me, it was
and things.
NFL pencils.
Nice.
That was like, that was like, you were, that was it. If you got the NFL package, you were a special cool kid. Mm-hmm. Yeah, definitely.
But I loved my locker. Like the locker was the cool thing, and organizing the locker. I'm not sure why I thought that the locker would be better organized than my bedroom, but I always had this idea that it would be, and it always ended up looking like a mess. But I thought the locker was the coolest thing, and learning your new combination. But I give pencils out now at my office for kids who are coming in for their checkups or even for sick visits. I think every kid needs a cool pencil. So I have pencils that kids can take. So
awesome.
It's just kind of me tapping into that old thing that I enjoyed. So
for me, it was we would go to Keeks, which was below the 30-second high V. You probably don't remember that, but it used to be high V on top, and then down below was Keeks, which was there's still Keeks downtown.
Yes. Mm-hmm.
They sell uniforms, police officer stuff, and you get a pair of Lee jeans, which was so stiff, because this is before they had pre-washed and stone washed or whatever,
right?
And they would just be just stiff as can be,
on.
Your hands would get blue if you rubbed your hands.
I remember I remember that because I always get a new pair of jeans for school. So. Well, thank you for visiting today. This is very interesting. Once again, this is Dr. Dinah Conti, pediatrician with UnityPoint Clinic Pediatrics, Tower Terrace, and Lindsey Fiechtner, physician assistant with UnityPoint Clinic Child and Adolescent Psychiatry. For more information on pediatric primary care and psychiatric services, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.